Hi, this is Professor Troy, and I wanted to make a brief video on PTSD, or post-traumatic stress disorder. So there are a couple of things to know about post-traumatic stress disorder. And the first thing to know about it is that the disorder has been going through a series of changes sort of since the inception. Um, in the 60s and 70s, it used to be called shell shock, and it used to be referred to that because it was typically found in soldiers who've had a traumatic experience, being exposed to an explosion, being exposed to a near-death experience, and it used to be sort of particularly confined to soldiers who were returning home from the war. Um, that diagnosis has changed with newer research, where I guess it must have been the DSM-3 which came out in the 80s, basically, or sorry, even the DSM-4, which basically changed the name of the disorder to PTSD, post-traumatic stress disorder. The disorder's kept its name, but it's still gone through and still going through a couple of different revisions now. Um, in general, what's happening with the disorder is, following the diagnosis of shell shock, people have now realized that it doesn't just happen to people in wars, it happens to people who have had other traumas. So they called it PTSD if somebody was suffering sort of an extended stress response after a sexual assault or a violent assault or a mugging or a near-death experience. But prior to the DSM-5, you couldn't be diagnosed with PTSD unless you actually directly suffered from a near-death or a perceived death experience. In the DSM-5, you can now suffer or be diagnosed from PTSD if you have actually witnessed something horrific. So a lot of the people who saw people jumping out of the buildings on September 11th to their death, a lot of the witnesses to that experienced symptoms of PTSD. So the diagnosis has been revised again to show that if you've had an experience of, witnessing something horrific, you can develop symptoms of PTSD. And it might even be, well, there is some research to indicate that it's evolving further. Some people are saying that you can suffer from PTSD not from one big trauma or one big stress. It might be a series of mid-level stressors. So if you've had a relatively high level of stress repeatedly, again and again, you can develop PTSD. It doesn't have to be one of these situations that's life or death. It doesn't have to be one overall dramatic situation. It could just be something brief. It could just be, something chronic, something long-term, and something that's happening sort of throughout a number of years. Basically, what PTSD is it's an extended stress response that happens after facing a stressor. Okay, if you look at the slide here, the ranges of the percentage of the population, or the estimated percentage of the population, are very, very broad, from 1 to 14%. It's probably somewhere in the middle. The number of people that have diagnosed or have been diagnosed with PTSD varies because a lot of people don't like to talk about it. A lot of people don't like to get help for the disorder. Sometimes it's misdiagnosed. And with the criteria to meet diagnosis for PTSD changing, it's hard to say what the actual numbers are. But in essence, what happens with PTSD is the individual suffers from a lasting stress response to a stressor that was, very extreme in the individual's life. And some of the symptoms are flashbacks, where they have recurrent thoughts about what happens, nightmares. They feel like they're in that situation again. They can look around and think that things that are around them are part of the original situation, right? You just feel like you're back in it. And that's one of the major symptoms of PTSD. Other symptoms of PTSD include sort of feeling like you're not part of the world that you're in. You kind of feel like the world is happening around you, but you're there, but not really connected to it. Another symptom of PTSD is, inability to attend to and concentrate on information. Obviously, increased anxiety, an increased startle response, where something that, kind of would normally just cause a little bit of jump in somebody, right? Somebody sneaks up behind you and you just kind of have to catch your breath for a second. Somebody with PTSD might have a very large, exaggerated response to that, where they might like run, or jump a few feet away, or, take a few seconds or a minute or two to recover from that, something that would be a small stressor that most people would recover from quickly. It's difficult to say what predicts, PTSD. Sometimes there's some research to indicate that higher levels of social support will lead to reduced levels of PTSD. There's some research to indicate that IQ levels might have an effect on PTSD, but we're not really sure. Some research indicates how we respond to the stressor immediately after. Will indicate or will increase or decrease the levels of PTSD. So, for example, if you focus a lot on having the individual talk about and re-experience the trauma right after a traumatic incident, that actually might increase the likelihood of PTSD, and not decrease it, where our usual response is, oh, have them talk about it, let them get it out, don't let them bottle it up. Sometimes actually letting the person sit with the trauma for a little while and try to get back to a normal routine can actually be better, in order to prevent PTSD, because the individual is not forced to re-experience this terrible thing again and again. We've sort of started to look, we initially looked at PTSD as an anxiety disorder, and anxiety is a strong component of it. Newer research is indicating that it might deserve a little bit of its own category. It might be shifted in the future, because it might not just be anxiety based. There could be a biological component to it. Some research indicates that the brain does change when exposed to a trauma, so it might not just be an anxiety thing. It could be triggering more of a biological process at work. But anyway, one other thing to think about with PTSD is time. People who suffer from PTSD, well, let me go back for a second. People who suffer from a trauma should have a normal stress response. You shouldn't just shrug it off. And it can bother you for a week or 2 weeks or a month. Usually there are time limits. So if it bothers you for typically about, 0 weeks to a month, that's just a normal stress response. If it bothers you from 1 month to 2 or 3 months, from 1 month to 6 months, that becomes an acute stress response, and you might be diagnosed with acute stress disorder. If it bothers you from 6 months and on, if you're still experiencing these symptoms, the flashbacks, the exaggerated startle response, the nightmares, then we would argue that at this point it's lasting too long and you have post-traumatic stress disorder. And there are treatments that can work for it. There are treatments that can be effective. And there are a few different ones. EMDR, which basically has the person re-experience the trauma in a safe way, not actually re-experience the trauma physically, but talk about it and think about it, and then change their eye movements. It can actually reduce PTSD in some individuals. Therapy, cognitive behavior therapy, analytic behavior therapy can be effective in dealing with PTSD. Some people find some comfort with some of the basic symptoms in medications, antidepressants, particularly, but it's a mixed bag. Everybody responds to the disorder differently, and everybody tends to respond to treatment differently. The biggest problem with PTSD is many people don't get treatment for it, and they self-medicate. They use drugs or alcohol to try to calm the symptoms. They engage in avoidance-based behaviors, and that can, sometimes make the symptoms worse or just not allow them to get better. But in a nutshell, that's PTSD. Okay, thank you for listening.